It feels a little bit as though COVID data has slipped off the agenda, but we keep tracking rises of the last few weeks.
Yes, it's exactly what I was just about to say. It does feel a bit like we're seeing these rises. The thing to note is that everything seems to be rising, so the trend is going upwards. So that is the number of COVID cases is rising, but also it seems to be rising across the nations. I'll go through these figures with you now. COVID cases have risen to 1.74 million across the country in the week until the 18th of June. That compares to 1.42 million cases in the week to the 11th of June. And what that means is that the number is higher overall, but it's a lower figure by which it is rising. Now, if we go through the different nations, what it shows is that 1 in 45 people in Wales had COVID in the week ending the 18th of June. For England, that number is 1 in 40. For Northern Ireland, it's 1 in 30. And for Scotland, that figure is 1 in 20. Now, what is causing these rises? Well, the ONS, that's the Office for National Statistics, says that it is likely to be caused by infections compatible with Omicron's BA.4 and BA.5 variants. Now, they're not the dominant strains. The BA.2 still up until June 12th was accountable for about 3/4 of the country's cases. But we know that that one, BA.2, the one that is responsible for 3/4, is 50% more transmissible. But according to a study in Boston, the BA.4 and the BA.5 are 3 times as resistant to neutralizing antibodies as the 0.1 and 0.2. So a little bit complicated there. But if we look at it in terms of practical things, we know that when it's summer, people are mixing more, perhaps. People are traveling more. So COVID cases can go up. With hay fever, people sneeze more. That can, we know, spread COVID more easily. What we're not seeing is hospitals under pressure. And so we don't know what the exact figures are for hospital admissions. A lot of people that are admitted to hospital may incidentally have COVID, but may be admitted for reasons other than for COVID. The good news, if we can say, is that people appear to continue to be testing, whether that's because they're testing through habit or because they know they're going to be in close contact with someone who's vulnerable, or even because they need a negative test in order to travel. So the good sign is that there is still a lot of testing going on in the community.